Quick disclaimer. Information in this podcast is for general informational purposes only and is not intended to be treated as medical advice. Always consult with your healthcare team before making changes to your diet, lifestyle, supplementation, or medication.
Are you curious about the secret behind the skyrocketing popularity of Ozempic and Wegovy? Today, we're uncovering the truth behind these weight loss wonders, exploring not only their benefits, but also the potential pitfalls that could be hiding beneath the surface.
Welcome to Type 2 Diabetes Talk, the place where we chat about what really works to treat type 2 diabetes and prediabetes naturally with nutrition and lifestyle. If you're looking to optimize blood sugar and A1C, lose weight, reduce medications, and improve your overall health, this is the place to be. Now, here's your host, Type 2 Diabetes Nutrition Specialist, Dr. Jeddah.
Hello, wonderful people. Dr. Jeddah here, and thanks so much for joining me. Today, we're exploring two medications that have gained significant attention: Ozempic and Wegovy. It wouldn't be far-fetched to say that drugs like Ozempic and Wegovy have taken the world by storm. With the promise of losing significant amounts of weight, there has been an explosion of people taking these drugs, to the extent that celebrities and others actually brag about using the medication to achieve their weight loss success, which is just crazy stuff. Before we dive into this topic, I want to note that I'm not sharing this information to scare anyone. For instance, if you might be taking the medications we're discussing in this episode today. The reason I'm noting this is I know some people can get offended by it. Providing facts from research and the actual product brochures is not designed to scare people, but to responsibly inform people. The evidence is the evidence, and it is the truth. So if you're not being informed by your doctor, where else might you be informed about it? It's important that you have all the information to make informed decisions and choices. I'm always curious to read the research surrounding these drugs, and over the past several months, I've bookmarked several papers that sparked interest. And a few months back, I was listening to a fascinating presentation by colleagues who spoke extensively about GLP-1 and these drugs. So the information I'm sharing today is the result of combining the research with the things learned from colleagues, along with information directly from the drugs, websites, and product labels. For our members, you can find all this information and additional information alongside episode 55 in the members library. For others, head to our website for this episode and abbreviated information. Let's start by understanding GLP-1. GLP-1 stands for glucagon-like peptide 1. GLP-1 is a hormone that plays a vital role in glucose metabolism. It is a naturally occurring hormone produced by our body in the intestines in response to food intake. One of its primary functions is to stimulate insulin secretion from the pancreas when blood sugar levels are elevated, which helps to lower blood sugar levels. In addition to promoting insulin secretion, GLP-1 suppresses the secretion of glucagon, another hormone that raises blood sugar levels. Glucagon is elevated in people with pre- and T2 diabetes, so this dual action of promoting insulin secretion and suppressing glucagon is critical for maintaining blood glucose balance, for maintaining blood sugar levels. Another thing that GLP-1 does is it delays stomach emptying, slowing down digestion, which helps reduce post-meal spikes in blood sugar. It also promotes satiety, or the feeling of fullness, which can be beneficial for reducing cravings and for weight management. Overall, GLP-1 has an impact on blood sugar control and appetite regulation. And remember, it is a naturally occurring hormone produced by our body. Now, let's talk about Ozempic and Wegovy. Ozempic and Wegovy, semaglutide, are injectable prescription medications made by the same company, Novo Nordisk. These two medications are designed to mimic the effect of GLP-1. Ozempic and Wegovy are known as GLP-1 receptor agonists. They bind to cellular receptors that GLP-1 would normally bind to, but in a different way, an elevated way. Essentially, they elevate the action of GLP-1 in a way the body couldn't achieve on its own, amplifying it to certain extremes depending on dosage. Ozempic and Wegovy are injected medications because taking them in pill form is not effective. The digestive process would break them down, reducing their efficacy. So injecting these medications allows them to enter the bloodstream directly, ensuring optimal absorption and action in the body. When introduced, semaglutide was FDA approved only for use as an anti-diabetic drug. We spoke about this way back in episode 17 and 18, when Sue Robody, a side effects expert, came on the podcast as a guest and spoke about her role on the FDA advisory committee when they approved these drugs. It was a very interesting discussion. Point being, Ozempic was first approved only for use as an anti-diabetic drug to lower blood glucose levels. When the drug was first being used as an anti-diabetic drug, it was noted that the drug had the benefit of reducing appetite and food intake and facilitating weight loss. Fast forward to now, and the drug Wegovy, which is essentially exactly the same drug as Ozempic, just a different brand name, is now approved as a weight loss drug, leading to the wild frenzy that is now occurring across the globe. When Ozempic was being primarily used as an anti-diabetic drug, it was only being prescribed in small, modest dosages of the medication, around 0.25 milligrams once a week. For that purpose, these drugs could be warranted where necessary because at these lower dosages, the benefits of the drug could outweigh potential side effects. However, the surge in the popularity for weight loss has prompted an increase in dosages. Currently, Ozempic can be prescribed up to 2.0 milligrams weekly, while Wegovy has doses that go up to 2.4 milligrams weekly. And it's this escalation in dosage that raises concerns about the long-term implications and potential side effects of higher doses being used for weight loss. Data comparing early prescribed doses of Ozempic to current practices highlights this significant shift, as initial prescribing was more conservative, focused on managing diabetes, whereas the current trends lean heavily towards weight management at increased doses. As we covered earlier, these GLP-1 agonist drugs elevate the action of GLP-1. They suppress glucagon, which helps bring the blood sugar levels under control, and they also have a direct effect on the fat cells, directly activating fat breakdown. All of that sounds great, right? Anyone wants to bring glucose down and spark fat loss. And in terms of weight loss, it might be easy to get excited about losing 5 to 20% of your body weight, which is the average range of weight reduction shown in clinical trials for these drugs. That could amount to up to 46 pounds or 20 kilos, as in some reports. And that's a substantial amount of weight loss by anyone's terms. But while the idea of a quick fix may sound appealing, there is much more to consider, as we'll get to a bit later. Another key benefit often promoted is that people say they don't get cravings anymore, and that's because the drug reduces appetite. It suppresses it. Again, any of us may think, yes, please, I want to reduce the cravings I get that hit me every day at 5 p.m. or 7 p.m. when that sugar monster seems to be calling my name, wanting me to eat that candy or chocolate cake or crisps or crackers. Later, we'll touch upon why this isn't necessarily a good outcome either. There was a recent study that looked at what factors influence the ability of people to achieve a 10% or greater weight reduction when taking semaglutide, and these were higher dosages of the drug, persistence with the medication, those who remained on it for a year or more, and patients with a higher BMI being treated. It is very difficult to stay on the medication long term, and therein lies the big issue for several reasons, which we will get to shortly as well.
It's time to leave all the noise and confusion behind and get proven, practical solutions that really work. Understand your diabetes and exactly what to eat to keep your blood sugar stable, lose weight, and reduce medications. All this and more is possible with Dr. Jetta's scientifically proven T2 diet program. Take charge of your diabetes health and join the program today. Visit type2diabetestalk.com/programs.
Losing weight and reducing cravings and hunger can be powerful motivators for wanting to try the drug. The other side of the equation, though, is there are the very real potential consequences, and you do need to take these into consideration. With every medication you take, there are side effects to consider. Doctors and pharmaceutical companies may play these down, emphasising the benefits, but the reality is they could happen to you. They can't guarantee they won't. The most notable concern made by the pharmaceutical company is the possibility of thyroid tumours, including cancer, thyroid cancer. The rate at which this may occur is still an unknown factor, as it's only a new drug. We haven't seen really long-term trials, so we still don't know at what rate this might occur. Another warning is changes in vision. Studies have shown semaglutide causes changes to vision, including blurred vision, worsening of diabetic retinopathy, and macular complications. Data around this side effect is still relatively new, so it's difficult again to conclude how severe symptoms may become, although some studies suggest a potentially higher risk of blindness. Other possible side effects noted on the product label and clearly on the drug websites are inflammation of your pancreas, known as pancreatitis. We have had acute pancreatitis requiring hospitalisation occur in a couple of our members, so this certainly does happen. Gallbladder problems, including gallstones that may need surgical removal, kidney problems and kidney failure, serious allergic reactions, increased heart rate, and depression or thoughts of suicide. These are all pretty serious side effects to consider should they affect you. The most common side effects reported by the pharmaceutical company on their website, and I quote, nausea, diarrhea, vomiting, constipation, stomach or abdomen pain, headache, tiredness or fatigue, upset stomach, dizziness, feeling bloated, belching, low blood sugar in people with type 2 diabetes, gas, stomach flu, heartburn, and runny nose or sore throat. Again, a fairly long list of common side effects. Certainly we know from the scientific literature that the most common side effects are these gastrointestinal disorders. In fact, studies have reported there are 45 different gastrointestinal side effects, the most common being the nausea, diarrhea, vomiting, and abdominal pain, along with others that aren't noted on the product label, such as dry mouth, abnormal gastrointestinal sounds, irregularity in bowel movements, and faeces being discoloured. And studies have shown that all doses increased gastrointestinal side effects, which can vary in severity and range in the length of time people experience them. Coming back to the fact that efficacy of the drug relies on a person taking it for at least a year, many people won't tolerate the gastrointestinal side effects alone. In fact, we've had members hospitalised from dehydration related to suffering the gastrointestinal side effects of semaglutide. These things certainly do happen to people, so this stuff is not a white elephant that happens on the odd occasion. They are a real, true possibility of potential side effects. So while it may be possible to achieve a year on the drug, published reports have indicated that within 2 years of starting the drug, around 70% of people choose to get off the drug because they are feeling incredibly sick on the drug and they just don't want to take it anymore. And that's a big, big issue. When you stop taking these drugs, you will gain all the weight back and likely more. You have to stay on the drug for life in order to maintain the weight loss. And at this early point of the drug's inception, widespread existence, we don't even know if that's possible or what the longer-term effects will be. We also know longer-term intake of these drugs is simply not possible for many people, as indicated by the fact that a large majority of people voluntarily want to stop taking the drug within 2 years of starting it. There's one other major downfall. Research has shown that 20 to 40% of the weight lost is weight loss from lean mass, which means you're not losing fat, but you're losing muscle mass. That's not good, especially as we get older. Muscle mass is essential for maintaining overall health and physical function as it supports mobility, balance, and strength, which are crucial for daily activities. Additionally, having adequate muscle mass contributes to our metabolic health by improving insulin sensitivity and aiding in weight management. After age 40, muscle mass can start to decline more noticeably. By age 60, we have an even harder time maintaining muscle and bone mass, and restoring it can be even more difficult, particularly for women with menopause and changes that occur in hormones that affect muscle and bone mass already. Before we go on to discuss this further, let's hear a testimonial from one of our members.
Lynn said, "My HbA1c is 5, down from 8.9, and I have lost 20 pounds and still losing usually 2.2 pounds a month. My GP is very pleased with me. I am extremely happy with these results, as I've tried and failed so many times to achieve these types of results. The program has taught me so much, and the food and your approach to it has made all the difference. My eating habits have changed dramatically. This, to me, is not just a diet, and I'm sure it's a permanent change and way of life for me in the future."
So let's just say you choose to take the drug for weight loss, and within a couple of years you decide to stop taking the drug. You will gain back the weight and you'll quickly gain back fat, but you won't gain your lean mass back. That muscle or bone loss can be permanent, if not incredibly difficult to restore. So one of the key downfalls is that on the other side, you will now actually be fatter than before. You might still weigh the same, but you'll have more fat mass and less lean mass. That's not good, as it can affect strength, mobility, and overall health, not to mention increased insulin resistance, and appetite and hunger are likely going to be more than you experienced before as well. Coming back to those cravings we talked about earlier, appetite and cravings are dramatically reduced because the drug influences the gut, the intestines, slowing down the movement of the intestines. In response to eating food, our intestines have a natural contraction process that moves everything from our stomach along the intestines for absorption and processing and through to our bowel for excretion. These drugs slow down the natural movement and contraction of the intestines. In fact, food can stay in the digestive system a lot longer than it should. Belching and foul breath can become a problem as food ferments in the stomach. And something else to consider is that due to the slower intestinal function, digestive function and nutrition absorption can become compromised, and this can lead to nutrient deficiency over time. More than that, it is possible that a complete paralysis of the intestines can occur due to these drugs. This condition is known as ileus, and it's potentially lethal. Ileus has occurred in people taking these semaglutide drugs and has led to about 20 deaths the last report I saw. But intestinal paralysis has been seen in clinical practice among colleagues, so it is certainly a very real consequence of these drugs. Ileus can lead potentially to permanent paralysis of the intestines with the need for tubes and bags to handle digestive processes, and that does not sound like a fun outcome for anyone, wouldn't you agree? Yet another downfall is that although cravings might be reduced initially, this effect wears off over time, perhaps around the 2-year mark, where you will see your cravings and appetite increasing once again. So you need to be upping the dosage of the drug, which is likely not possible for many people as dosages will already be so high. What's interesting is there have been many papers being released about the benefits of these drugs for all sorts of things, from improving heart disease, cognitive function, to reducing risk of certain cancers and Alzheimer's disease. There are a lot of things coming out around this, and so early of the drug being released, it seems rather astonishing. Certainly it is true that these reports have examined positive benefits, and they sure are hailing these benefits far and wide, no doubt to try outweigh the negatives. In reality, colleagues have noted that the more likely consequence of these benefits is because the drug is decreasing insulin resistance and improving insulin sensitivity throughout the body's cells. Insulin resistance is at the centre of many chronic health conditions, and if we address the insulin resistance, we reduce the risk of heart disease, stroke, Alzheimer's, cancer, and the list goes on. As we covered in episode 26 on insulin resistance, we can also improve this with nutrition. In any case, what we've covered here is that the short-term benefits may look good, but the long-term consequences of these weight loss and blood sugar lowering medications, based on the evidence, the long-term metabolic consequences do not seem worth the risks. Is it really possible to keep taking a drug forever? If not, which appears to be the case for many, then you're not just back at square one, but square minus 10, as you'll be left with more fat mass and less lean mass. And again, you'll have to look at other options anyway. You'll be left to look at options you could have potentially used in the first place, namely focusing on nutrition. By far, the healthiest, most sustainable way to lose weight long-term is through nutrition and dietary changes, coupled with changing some things in our lifestyle. If you've listened to this podcast a while, you've heard of Wilma's 79-pound weight loss. That's 36 kilos. Head to our testimonials page to view hundreds of testimonials from our members with their blood sugar and weight loss success. Karen losing 15 pounds in a few months, Susan 24 pounds, Lynn 44 pounds, Cheryl 21 pounds, and the list goes on. And most tell us they are so happy with the weight loss because they have tried to lose weight for years and never could. The key is you've got to work with your body, not against it, which is what much of the dieting culture for years on end has made us do. So we can help you lose weight naturally, so please head down to our website and join us as a member. It is difficult to do on your own. You need the right guidelines, the right tools, and the ongoing support to achieve it. That's what's helped all our members get better results. So just head to our website to view the testimonials, and please do consider joining us. You don't have to do it alone. Again, I want to emphasize that I've shared this information about GLP-1s and Ozempic and Wegovy today to inform you about potential consequences of these semaglutide medications. If you're already taking these drugs, you may wish to consider working with your doctor to reduce them over time, in conjunction with working on your nutrition with a program such as the T2 Diet program, or joining us as a member. If you're not yet taking them but have been considering the option, perhaps now you may reconsider the longer-term outcomes and pursue a different option, focusing on your nutrition. Either way, I hope you have found this episode informative and helpful. That's all for now. Take care of you. Dr. Jeddah, over and out.
Thanks for tuning in to Type 2 Diabetes Talk. Please subscribe to the show on your favorite podcast platform. And for episode replays, episode notes, and more, visit type2diabetestalk.com. New episodes are available Tuesdays, 10 a.m. U.S. Eastern Time, or your time zone equivalent. Thanks again. We're truly grateful to be a part of your life and help make a real difference.